Say the name Angelina Jolie and you probably immediately think of Brad Pitt, her brood of children from the United Nations, and her striking beauty. Recently, Angelina has also become synonymous with breast cancer, having revealed she chose to have a preventative double mastectomy.
The death of Angelina Jolie's mother due to ovarian cancer prompted the Oscar winner to have herself genetically tested. She discovered she carried a gene which put her at high risk for breast cancer and opted to undergo elective surgery in hopes that her choice will educate women in the same situation.
Choosing to have a mastectomy isn't an easy decision, nor is it a simple operation. To help us understand the procedure, we have Prof. Justus Apffelstaedt, who is the head of the Division of Neck and Breast Surgery at the Stellenbosch University, as well as Prof. Frank Graewe, who is the head of Plastic and Reconstructive Surgery at Stellenbosch University. Welcome, gentlemen. Angelina Jolie had a mom who had breast cancer. Positive family history. She also has a BRCA1 gene. And as a result of this, she decided to have prophylactic double mastectomies. Is this the usual course of action?
Yes. People who suffer from an abnormality in the BRCA1 gene, like Angelina Jolie, have an about 90% chance of getting breast cancer. And we see it that especially young women, out of fear of breast cancer, having seen what their mothers went through, just like in the case of Angelina Jolie, choose this option to avoid the risk. Nowadays, with modern plastic and reconstructive methods, we can actually keep the outer contour of the breast, also the nipple areola complex, and this gives the women a virtually normal appearance.
What are the different types of mastectomies, and which was the mastectomy that Angelina Jolie actually did have?
For advanced cancers, we do so-called modified radical mastectomies, where the entire breast and the skin and the nipple areola complex is taken away. Yes. What Angelina Jolie had was a subcutaneous mastectomy that takes away only the glandular tissue underneath the skin, but leaves the skin, the nipple, and the areola intact.
What is the actual risk reduction from having a procedure like this?
From a 90% chance of having breast cancer, we can bring women down to a lifetime chance of having breast cancer of about 5%, which is lower than the normal woman in the street has.
There are other options for preventing breast cancer. Regular breast self-examinations, annual breast checks by a doctor or nurse, and regular mammograms for women over the age of 40 are reliable screening methods for breast cancer.
You've done your subcutaneous or skin-sparing and nipple-sparing mastectomies, and now you want to go for a reconstruction. What are the various options?
The two options that we have is to use your own tissue, is one option, or you go for alloplastic or implant reconstruction.
So you have the implants over here. This is one option, but you can actually use your own body tissue.
That's another option. So let's talk about the implant as such. I brought a range of implants. You can see there's from the expander.
Yes.
This is what Angelina Jolie had. This is the typical implant we use in breast reconstruction in an anatomical shape. Already has the shape of a breast if you compare it. We, in our practice, mostly use implants immediately. We want to make it a one-stage procedure. So the subcutaneous mastectomy is performed, nipple areola sparing, and then we actually use this implant, put it either under the skin or the muscle.
Now the expander, would you use it in conjunction with the implant?
We use the expander if there's not enough skin, if patients have to go for radiation, and we flatten the chest to make it easier for the radiation to take place, and then afterwards we can expand it again or use a normal implant again.
The genetic test and elective mastectomy procedure chosen by Angelina Jolie is available in South Africa. While some medical aid schemes may not cover the cost, government hospitals can do the procedure at minimal or no cost to the patient. This is a viable option for women who have a history of breast cancer in their family.
What are your final tips or take-home messages to women out there who may be concerned that they have a history or they have a higher risk of developing this?
I think it's very important that these women actively seek out a center that has an awful lot of experience in this. And it's a rare disease, and it belongs into the realm of super specialist clinics with a specific interest that can offer the patient all the options and also appropriately counsel these affected women.
I think important message from my point of view is there is a reconstruction possible for almost everyone. But we have to look at each patient individually and then decide from the treatment that comes together with it and the body habitus what is the best option for that specific patient.
Earlier this week, Angelina Jolie's aunt, Debbie Martin, passed away after a long battle with breast cancer. As tragic as this may be, many women do survive breast cancer, like former Miss South Africa Wilma van der Bijl and from Journey of Hope, Ferhana Coovadia. Both women were surprised by their diagnosis and then endured surgery plus additional treatment such as chemotherapy and radiation. Now they have a clean bill of health and dedicate their time to raising awareness around breast cancer.
Welcome, Ferhana Coovadia and Wilma van der Bijl.
Thank you.
Ladies, the Angelina Jolie story has been everywhere. What are your opinions of her choice of action? Wilma?
Given her background, I'm sure she made the right choice, and I do believe she's a very intelligent lady, and she must have researched and taken all her options, and I would have done the same.
If I was given the option and if I was also tested positively, then I would have done the same.
It almost seems extremely radical.
It does seem, but I think she's got children, and at my stage I also had very young children. I was only 42. So you want to see your children grow up. So that's probably one of the deciding factors as well.
That seems to be the major deciding factor. So Wilma, what is your story? How did you find out you had this disease?
I went for a basic mammogram checkup, yearly routinely checkup. And when I was diagnosed, I've done a lot of research. I went for second opinions, and the second opinions also said the best option is to remove the one breast fully, but also to do the other breast.
I also went for a routine mammogram, and it was picked up there. I was given a choice of either having a full mastectomy with no radiation or chemo, or either to have the lumpectomy with radiation and chemo, and that's what I chose.
So what do you physically go through with your various forms of treatment?
Well, I had the bilateral mastectomy, and then I had chemo treatment and radiotherapy, and then obviously the 5-year preventative medication afterwards. And it is quite a long route to follow, but I think if you inform the whole time and you know exactly why you're doing it, and you get through it. It's not easy.
And what was your experience like?
You know, I took it each day as it came. It was a very difficult journey. It's a long journey. It taught me a lot of patience. And I realized that, you know, I had to embrace the chemo and the radiation as being part of the cure and not as being part of the actual disease. And that was something that gave me this strength to go on, because every day to me felt like I'm getting closer to being cured of it.
Because the chemo is actually quite distressing sometimes.
Chemo is not a walk in the park.
Yes.
I mean, there were days, and I'm sure Wilma will agree with me, that there were days when I just felt that I couldn't go on. But that's when my family and friends came in, and I think it's very, very important to have a good support system.
You realize how much friends and especially your family means to you, and they just want to take care. And all I can say is let them take care for a change.
Oh, of course, definitely. You know? So what are your tips for ladies out there about how to deal with issues surrounding breast cancer?
Well, first of all, you have to take care of yourself and go to a doctor, make appointments. That sixth sense that says to you something is wrong, it could be you. You believe it's not going to be you, but it could be you. Here we are.
Self-exams.
Self-exams, very important, I think, because if you know your body well, then if there is any change, you'll be the first one to pick it up. As Wilma said, we have to take responsibility for our own health and go for our routine mammograms. I mean, both of us were picked up because of routine mammograms. I have friends who are in their 60s who've never been for a mammogram because they heard it was too painful. And I always tell them it's not as painful as chemo.
Exactly. It's exactly what I always say. It's not as painful. Have a panado before then, and you rather want the panado than the chemo afterwards.
Definitely.
If you're too late. And we are fortunate to sit here and tell the story, and we were early enough. But there are people who postpone and are too scared, and then they're too late.
Thank you, ladies, for sharing your stories. You're definitely an inspiration to many.